is a video presentation of our poster for the effect of preoperative administration of anxiety medications on postoperative pain in patients undergoing total abdominal hysterectomy. My name is Tina Frykowski.
My name is Yana Slagra.
My name is Ana Martinez.
My name is Michelle House.
I'm going to go ahead and go into the abstract portion of this presentation, which states pain and anxiety are psychological stressors patients experience when undergoing surgery. There is little research documenting effective treatments in patients preoperatively to produce better postoperative outcomes. The aim of this research proposal is to assess the relationship of premedicating with anxiolytic medications for anxiety to improve postoperative pain responses in patients undergoing total abdominal hysterectomy. The population consists of 60 patients between the ages of 18 and 65 years old. Under the State Anxiety Score of the Spielberg State Trait Anxiety Inventory, also known as STAI, 30 patients were selected as anxious or 30 patients not anxious. The anxious patients were randomly assigned Group A, who received lorazepam the night and 2 hours before surgery, and Group B received a placebo. The non-anxious patients were also randomly assigned to Group C, who received lorazepam at the same amount at the same time, and Group D received the placebo. For pain, tramadol was self-administered using the patient-controlled analgesia, also known as the PCA pump. And postoperative pain will be assessed during the first 24 hours of the study. Another scale, called the visual analog, will reveal the patient's pain responses, and PCA pump will reveal pain medication consumption. Based on the literature reviews, we will predict there is a positive relation to premedicating total abdominal hysterectomy patients with anxiolytic medication and pain responses. So, into our introduction. Hysterectomy surgeries are a frequent procedure performed in women for various reasons. These are not simple procedures where surgeries are performed in outpatient clinics or released the same day. Hysterectomies involve removing all or all parts of the female reproductive organs for various reasons. Munjamdar and Saleh write the reasons as uterine bleeding, pelvic pain, and malignancies. In addition, their study focused on the psychological components related to post-operative recovery and including a saying for anxiety preoperatively. This raises an interesting subject in exploring published data pertaining to assessing and treating patients undergoing hysterectomies with anxiolytic medications, with raised awareness of improving recovery specifically in regards to pain responses. In order to gain a better understanding, this research proposal will test if there is a positive relation to premedicating total abdominal hysterectomy patients with anxiolytic medications and pain responses. This study is expected to show a solution in improving postoperative pain responses by premedicating patients with anxiolytic medications. The study will use visual analog scales and the State Anxiety Score of the Spielberg State Trait Anxiety Inventory. These two testing methods will evaluate for pain and anxiety. The significance of this study is to provide relevant, evidence-based research for promoting quality of care by assessments designed to identify those with anxiety. This study will help provide additional findings, focuses to utilize in policy making concerning pain management postoperatively.
Next, we will review more intensively the methodology. Based on the literature review that we did, we picked one study completed by Sikosi and the rest of the authors in 2007. Now, why did we pick this study? It was because it was a complete study that included everything that we wanted to achieve with this nursing proposal. So with that said, I'm just gonna go ahead and describe what we did. We picked a randomized, double-blind, placebo-controlled study. With that said, we sent the study for the IRB committee to be approved. Then after that, we picked the population that we wanted to work with, and then we picked 18 to 65 years old females undergoing elective total abdominal hysterectomy. Now, out of those patients, we picked 60 patients in total, which signed consent, and we also excluded some patients. The exclusion criteria included malignancy, history of substance abuse and smoking, chronic pain lasting more than 6 months, a history of congestive heart failure, valvular heart disease, renal or hepatic disease, a psychiatric disorder, the use of psychotropic drugs, mental impairment, patients with language and communication difficulties, chronic anxiolytic drugs consumption, contraindications to suprachnoid anesthesia or PCA, and patients with body mass index BMI greater than 35 were also excluded. Now, with that said, how do we measure the patients for anxiety? We use the state test, which is a questionnaire that scores. If their scores were greater than 51 or equal than 51, the patients were classified as anxious. Now, if their score was less or equal than 50, the patients were classified as non-anxious. With that said, then we divided our population in 30. 30 were classified as anxious, and 30 patients were classified as non-anxious. And as my previous nurse said, then we divided the groups. We subdivided the groups. The 30 patients that were classified as anxious were subdivided in 2 groups of 15 patients each, randomized, of course. Group A received lorazepam, 0.035 milligrams per kilogram. And then Group B, out of the anxious patients, 15 of them received the placebo. Then, when we go to the 30 patients that were classified as non-anxious, then we also subdivided in 2 groups of 15 patients each. Group C, I'm sorry. Can you take this? I'm sorry. So Group C received, out of the non-anxious patients, received the lorazepam, 0.035 milligrams per kilogram, the same amount. And Group D received the placebo. When did they receive it? They received the lorazepam the night before the surgery and 2 hours before the surgery. Now, that's the study group. What else do we do? We actually, after dividing the groups, we select the anesthesia. Now, the next step will be selecting the type of anesthesia. In this case, we selected the subarachnoid block. And with that said, every patient had the same type of anesthesia with the same anesthesiologist. So, and also the same surgeon performed all of the surgeries with the same abdominal incision. And we took notes of the amount of blood loss, the vital signs, everything related with the surgery also. Now, let's go to the pain. How do we assess the pain postoperatively? Previous to the surgery, the anesthesiologist was in charge to instruct the patients about the use of the PCA pump, and also instruct the patient how to use the VAS scale. After that, after the surgery, once the patient got out of the surgery, the patient received ketorolac, 0.25 milligrams per kilograms IV. And then the patient was to use the PCA pump with a bolus dose of 0.2 milligrams per kilograms with a lockout period of 5 minutes and a max dose of 1 milligram per kilogram in 1 hour. Now, the pain consumption and the pain level were assessed 2 hours, 4 hours, 8 and 12 and 18 and 24 hours after the surgery. That's how we assessed. And now we're gonna go into our discussions and findings.
Our findings are based on the studies done by several researchers who demonstrate the correlation between pre-medicating with an anti-anxiety medications and pain reductions. Our nursing proposal is going to be based on Psychosi, and that he did this research in 2007. During the first 24 hours post-surgery, the tramadol consumption was significantly greater in patients that were anxious and received the placebo as pre-medication. The study confirmed a direct relationship that exists between pre-operative anxiety and pain reduction. In their finding, the oral melatonin 6 mg or pregabalin 150 mg 1 hour before operation had reduced perioperative anxiety and preoperative pain. In a study completed by Khan, Siddiqui, and Akhil in 2013, they used gabapentin 1,200 mg preoperative with the purpose of also reducing pain and the narcotic requirements. The study shows that the results. Our study showed that pre-medicating patients with a pre-anxiety medication highly reduced their pain medication levels, their pain levels, and it reduced their narcotic requirements and use.
Hi. Based on the conclusion, in conclusion, based on the results of the studies and the literature reviewed, our hypothesis is most likely to be correct. Therefore, we believe that there is a positive relation to pre-medicating patients that had a total abdominal hip replacement with analytic medications and pain responses. We believe that lorazepam will reduce pre-operative anxiety, resulting in better post-operative pain control, reduced anxiety, and comfortable hospital stays in patients with TAH as supported by CKASI. These research studies provided preliminary evidence-based results we are looking for. Our ultimate goal is to continue to broaden and broaden our research efforts using the state and VAST methodology to show and support the use of lorazepam and tramadol pre-operatively for better post-operatively patient outcomes.
Thank you.